Members, good morning. It's the appointed time. We have a quorum. I call the meeting to order. The Secretariat has not issued any information paper since the last meeting. The regular meeting in July will take place on the 13th of July, which is a Monday at 10:45. The administration proposes to discuss 1. Impact assessment of targeted poverty alleviation schemes, and 2. Report on impact of targeted poverty alleviation strategy in Hong Kong. These two items are related. The administration proposes to have a joint discussion on the two items. Do you agree? Thank you. There are two items on today's agenda. One is the carer support data platform and services supporting the carers. I had a discussion with the administration. I think it would be better to have a joint discussion on the two items. There is a Bills Committee being conducted at another venue. So if you want to ask questions under the joint discussion arrangement, members may ask questions on either of the items. Please refer to paper CB bracket 1570/2026 brackets 03, 04, 05, and 06. I now ask the Undersecretary, Mr. Jonathan Ho, to take us through the paper. Members, if you'd like to ask questions, please press the Request to Speak button. Thank you. Carers play a pivotal role in supporting elderly persons and persons with disabilities, PWD. Starting from 2022, the administration has put in place a number of measures to support carers. They are in the form of financial subsidies as well as support in kind. We don't just want to alleviate pressure faced by these families. We want to put in place a continuous policy to support those in need. We will make use of technology. We will expand channels as well as early identification. In terms of early identification, we're doing two things. First, district services as well as the District Services and Community Care Teams scheme on supporting elderly and carers. In March 2024, it was run on a pilot basis in Tsuen Wan and Southern District, and it was later extended to the whole territory in April 2025. Care teams will help identify carers of elderly persons and carers of PWDs in need. We have reached out over to 110,000 households. We will extend the pilot scheme for another 3 years. In addition, we have launched a Support for Carers project. Starting from October 2023, the project was implemented by the Social Welfare Department. Service units will provide training for frontline property management personnel to help them acquire the skills to identify and assist needy PWDs and elderly persons. So far, we have reached out to 450 property management companies and covered more than 4,140 residential buildings, reaching out to 14,200 personnel. In terms of expanding channels, we have a number of measures. First, the Information Gateway for Carers. It was launched in November 2023. This consolidates service information, caring skills, communities, activities, and support resources for elderly persons and PWDs as well as their carers. In March, we have added the Carer Condition Review Scale to help carers better understand their stress and needs. So far, we have accumulated 7.936 million click rates. We will enhance existing AI chatbot functions so that the gateway will evolve into a digital support tool that will better address needs. There is the designated hotline for carer support 182-183. For carers in need, they can make use of this hotline to seek support. In September 2023, this hotline was launched by the SWD. It was manned round the clock, providing real-time consultation, emotional support and counseling, outreach and emergency support, as well as welfare service referrals and respite services. We have handled over 160,000 cases and referred 4,350 cases to community support service units. We've also provided emergency support through outreach for over 280 cases. In terms of respite services, we have expanded our network, and we also provide support to service providers and aim to make better use of occasional vacancies to alleviate carers' stress and prevent crises. In addition, we have a parent, patients resource center and peer support service. We have set up 23 resource centers, providing services, counseling, service information, emotional support groups, community education, caring skills workshops, and social and recreational activities for parents, relatives, and carers. In October 2025, we have created 90 additional peer support posts in district support centers for PWDs with a view to building for PWDs a support network grounded in shared lived experience and sustained companionship. We make use of technology. We set up the Carer Support Data Platform. We heard continuous voices asking for using technology to help identify high-risk households and their carers so that we can prevent tragedies. In this regard, the government shares the same view. We understand that data is scattered across systems and databases in different government bureaus, departments, and organizations. We need to make good use of the data while ensuring that we meet all the requirements under the Personal Data Privacy Ordinance. As said in the Policy Address 2025, the government has established the first phase of the data platform to identify high-risk cases and provide early support. I would like to thank the Office of the Privacy Commissioner for their professional support and views. Their input ensures that all requirements are met under the PDPO. In July 2025, the first phase of the data platform was established and commissioned. We have launched 2 pilot schemes in collaboration with the Housing Authority and the Hospital Authority. You'll find the information in paragraph 6 of the paper under Agenda 3. The scheme consolidates information under the Housing Authority to help identify high-risk PRH households by providing timely support to them. We have visited over 35,000 high-risk households and made over 2,900 referrals. The second one is a pilot scheme in collaboration with the Hospital Authority. It aims at providing timely emergency support when the carers are hospitalized. The information in the hospital data is matched with the information in the SWD. Notification will be given to the carers so that they can ask for support. We have handled over 6,000 cases. The way forward is that while protecting privacy, security, we will continue to expand the coverage of the data platform. In terms of coverage, it will be expanded to those living under housing projects of the Housing Society. With the support of the Home Affairs Department and the Census and Statistics Department, we have identified high-risk households living in 3 new buildings not receiving social welfare service support. Starting from March this year, we have mobilized the care teams to reach out and visit these households and provide assistance as needed. We will enhance the various support measures. In addition to the data platform, we make use of technology. In March this year, we have launched a 2-year scheme to install pilot scheme on intelligent accident detection systems for high-risk households. We have provided assistance to no fewer than 300 high-risk households by installing these systems for them so that there will be real-time detection, early intervention, and prompt assistance provided. We have asked Xi'an University to evaluate the effectiveness. If need be, we will make improvements and adjustments. That's my presentation for the 2 papers. We'll be happy to take questions. Thank you. Let me read out the names of 9 members. They would like to speak. First, Mr. Lo Meng Kwong, Mr. Andrew Lam, Mr. Tam Chun Kwok, Mr. Chang Pui Kong, Mr. Hong Kam In, Professor Chen Wing Kong, Ms. Grace Chan, Mr. Alex Fan, and Ms. Jovi Chan. This is a joint discussion. Members will have a bit more time. We'll start with 5 minutes each, question and answer included. Mr. Leung. I would like to give recognition to the efforts made by the administration in terms of carers support policy. It's been improving in terms of data. It's used to help identify high-risk cases. We want to help as many people as we can. The direction itself is correct. However, our concern is that there may still be some cases that have gone through the net. There is a case, the mother taking care of a mentally ill daughter was found to be dead for 2 days. The daughter was staying with the corpse for 2 days before the case was discovered. And this case was not identified by the district care teams nor on the list of cases handled by the SWD. So this case has slipped through the net. These cases have not sought assistance before. They are not serious cases. Well, leaving this case aside, there are also some other cases as well. Say, for example, an elderly person taking care of someone who's chronically ill, someone who's suffering from mental illness. Under the current mechanism, they are still not found. There are collaborations with the Housing Authority, with the Housing Society, as well as the Hospital Authority. And if these cases are not found or identified as high risk needing help, then the net you have weaved that is supposed to be quite comprehensive will not be of effective use. So will you consider trying to cover cases that we have not focused on, say, for example, people suffering from mental illness? Will they be included in your mechanism or your system so that assistance will be provided to them? Let me speak first, and I'll defer to my colleagues if need be. Thank you for the question. Of course, we would like to prevent tragedies. We would like to provide assistance and have intervention before they even ask. Mr. Le mentioned about a case. Perhaps it's the case that the persons involved were not considered old and they've not been included in the social welfare network. But we have a network covering carers. I don't know whether this case was included. We have criteria to define high-risk cases. Say, for example, age. We have to draw a line somewhere. We will consider expanding the network But we have to first test the capacity of the organizations. We don't want to see any tragedies. We'll do our best. Through the designated hotline, we try to provide help, that is, the 182, 183. 3 years ago, the situation was that most of the calls were for emotional support. Starting from 2025, we saw that the highest number of calls seeking assistance are asking for skills and support for carers. So we provide support to carers. I'll see if my colleagues have anything to add.
I would like to add that, as mentioned in our document, we would like to weave a better social safety net. So, and for disabled persons, we would like to provide more support for the applicants and also applicants applying for residential services, and we would also like to include the carers into our list. And the case mentioned by Mr. Leung, the mental illness case, and also intellectually disabled persons, they are included as well. So we hope that we can include them later on. Thank you, Chairperson. So next, Mr. Andrew Lam. Thank you, Chairperson. So these two documents, I'm very happy about the direction and progress. You're using big data and technology to provide services. The medical, social, housing tripartite network is very pleasing. And I think the project is progressing very well, like providing more support network. And I also see that not only for the public sector, like promoting the collaboration with property management companies and also in 3 new buildings, and I think these are very promising. But I see a few issues. Firstly, about the data platform. Actually, in paragraph 6 about the pilot scheme with the housing authority, there are unreferred cases. So I would like to know whether there are cases that had been contacted but they refused to be helped, or cases that could not be reached. For these cases, if you cannot contact these cases, how do you follow up and how do you assess the risks? Secondly, in paragraph 11, it's mentioned that the data platform will be enhanced and systemized. But it's also mentioned that it's for controlling risks. It's a paragraph about the technical side. So I would like to know, what does risk mean? Would you please provide more details? And about carer support services, the other document in paragraph 9, it's the hotline was mentioned. So I think the hotline has been very popular, 116,000 calls. So it's over 100 or 200 calls each day. It's a lot of work. And the hotline is staffed 24 hours. So I would like to know more about the manpower situation. So are the staff able to handle the work? And in paragraph 15, the accident monitoring system. So there's a pilot scheme involving 300 households. There are 52 applications so far. 1/6 of the target has been met within a few months, so it will be quick for you to meet the target. So if you meet the target within such a short period, what do you do? Do you add more quota, or do you still observe how it will be? Thank you, Chairperson. So after talking about the hotline, I'll ask my coworkers to add details. Thank you, Mr. Lam. Things are progressing well. As mentioned by Mr. Leung, most calls we receive are about emotional support and service inquiry. About 60% is emotional support, 30% is social service inquiry, and 10% is about the other services. But in last year, the data has changed. The numbers have changed. There are about 18,000 calls about emotional support and 11,000 about social service inquiry and 15,000 about other support services. And in 2020, and this year, 2026, and calls for emotional support has dropped to 927, and calls for the other services have increased. So I think things are going in the right turn. And I think more inquiries are about more practical issues. So this hotline is, as you can see, very useful. And we will look after its capacity because the operator has an agreement with us and they will hire more people when needed. And they will keep a basic level of manpower. If there's important issues, they will add more manpower. We will review it from time to time, and I would like to invite Mrs. Kang to add more details. Yes, every time when we knock on the door, the resident is here. If they can't see anyone, they will visit again. So we visit maybe 3,000 households, 30,000 households already. There were 2,900 social welfare service referrals. And we hope that by contacting with them, they will know more about our social welfare services and accept our referrals. And we will continue to keep on with the care team services. And in terms of the risks, in the first phase of our data platform, the automation has not been fully completed. So in our pilot scheme, some processes are done manually. So we hope that through continuous enhancement, we can increase the coverage and increase more households, no matter in terms of referral or intervention, we can provide more timely services. And also for the smart device covering 300 households, as mentioned in the document, this is a tripartite cooperation initiative. So this is sponsored by the HKEX fund. So this fund supports us to provide services for around 300 households. Of course, we will keep an eye on how the demand will develop, and then we will review and see if we can add more services. So I'll talk about the manpower. The project includes many services, and care teams will be mobilized. We have visited 35,000 high-risk households, and we have mobilized care teams to do it. And there were 2,900 social welfare service referrals as well. And we had taken in some cases. So it's not only these services, we have also taken in cases through the hotline as well. So our social welfare organizations in different districts have also taken in more cases. Therefore, the manpower works within a framework, so we need to follow every step. And we will review where our bottleneck is and where we need more manpower, no matter in SWD or our organizations, we will do the review. And I would also like to talk about the referral number. Around 1/3 of the referrals are about elderly care services, and also in terms of housing care services, and the other services around 15%, and mental health service around 3%. Or maybe sometimes care teams cannot decide at that moment what services are needed, or if they need some other resources, or if they would like to join some activities, we will refer them to our district offices. We will review these data and see how we can improve or restructure our manpower. So for manpower, this is all I have to say. Thank you, Chairperson. Next, Mr. Tam Chun Kwok. Thank you, Chairperson. Firstly, I would like to express appreciation for what the administration has done. I would like to follow up on the subsidies for low-income caretaker families. The scheme has been running for 2 years. So for the amount of allowance and also the eligibility criteria, will the government have a review mechanism from time to time? Because it's very hard to take care of someone who is bedridden or someone who is disabled, and different caretaking requires different level of care. So how does the government provide subsidies or allowances for these different caretakers? So I support the government use of big data to support families with caretaking duties. And also the pilot scheme as well is very effective. And I would like to know more about the pilot scheme with the Housing Authority. It has been expanded to 18 districts, and it will be, and the public rental housing residents will also be included. Like Kutong North, there will be a lot of public housings. So will the government start identifying these high-risk caretaking families starting from the allocation of housing and to provide more instant support for them? So thank you, Chairperson. So I would like to talk about the low-income allowance. It is a pilot scheme. It's for caretakers who are not supported by any allowance because we know that they earn very little. It's not about the. So we provide an allowance for them because they have to take care of their family and they have to work as well. So it's tough for them. So we adopt a principle. We don't provide multiple allowances. So at the moment, we don't have a plan to cover those who already have old age living allowance and also other allowances. And as mentioned, will we divide caretakers into different categories? We don't have such plan. Because, of course, we will help you to take care of your family. But usually the caretakers have already enjoyed some other services, other caretaking services. So we would like to support them not by paying them money, but through providing other service measures. And also maybe more on daycare services, so we will not have much adjustment.
I defer to Mr. Ng, the Assistant Director, in relation to the living allowance for carers. We have regularized the scheme. Outside the allowance for carers, we take into account the situation of the one being cared by providing different support. We have disability allowance, lower and ordinary allowance. There is also a special subsidy for those who are under the age of 65 living in the community, receiving higher amount of disability allowance to help them procure equipment. There are also different subsidies available for people with disabilities. So we have taken into account the different degrees of disability of the one being cared. It's just that it's not for the carer. Commissioner, Mr. Tam talks about doing more before population intake of new public housing projects. We'll closely liaise with the housing authority. We will regularly update information to include high-risk households into our database. Next, Mr. Chong Pui Kong. Thank you. I would like to recognize the work provided by the Labor and Welfare Bureau. I have some questions. Just now, someone mentioned about the allowance for carers. If need be, if possible, please increase the amount. A lot of carers have to give up their job so as to take care of their family. And the allowance has a high threshold and the amount is not sufficient. If they only receive about $3,000, I hope that the amount will be increased because after all they have quit their jobs. Just now, the Undersecretary mentioned about the pilot scheme launched in March this year, pilot scheme on installing intelligent accident detection systems for high-risk households. It's been almost 6 months. Is there any update in terms of information? You talked about support from a foundation as well as a collaboration of government, business and a community. The pilot scheme will run for 2 years, but we'll only see a review after that. If it is a good scheme, will the review be move forward? Will the number of places will the number of places be increased to those who elderly people living by themselves or with their partner to have these detection devices installed in order to enable early intervention and assistance provision. There is also the care team. I'm a member of a care team in Shau Mau Ping Central. Whether they are team members or volunteers, they do their best to assist the government. They've done a lot of work. Just now, the Undersecretary talked about the way forward. High-risk households will be incorporated. Living in housing society projects will be incorporated. Households living in 3 new buildings will be incorporated as well. That means a heavier workload for care teams. But the care team doesn't get funding from the government. They are not staff members. They work on a voluntary basis. Will the government consider increasing the amount of financial support to care teams? I understand that it's just about $200,000 a year currently, which is not enough. The teams have put in a huge effort to support the government in terms of district work. So can the amount of funding support be increased? Undersecretary. I defer to the Commissioner on the question of smart technology. This is a pilot scheme. There are different equipment, infrared devices, radar. We want to identify the most suitable device for the use of elderly people living in Hong Kong. The second part is the provision of suitable assistance when something happens. The financial resources available for district care teams, we thank them for their support. We give them support to procure supplies to be distributed. Social workers will help them in their visit as well. We refer to the service agreement to provide support based on the area they serve. We will work with the Home Affairs Department on resources allocation. We understand that members would like to get more financial resources for carers in low-income families. But we're talking about capacity as well. We provide about $80 billion to $90 billion a year to those who are being cared. The living allowance for carers from low-income families are those who are younger and able-bodied. If we expand the network, of course, we understand the plight they're in. But if we weave the net too wide, will we be able to fund it? They may not be financially viable. I would defer to the Commissioner as well as the Assistant Director. Commissioner. The scheme covering 300 households. Let me give you further information. We have got sponsor from the Hong Kong EX Foundation. There are 2 separate projects. One is just the use of a special device for trip prevention. The other one is the emergency alarm system. Well, there are also other sensors to detect motion, to detect water leakage. And of course, there is the emergency alarm system as well. We make use of the 2 pilot schemes to see which detection device will best help us. It's a pilot scheme of 2 years. Of course, we don't want to see any accidents, but we will still need to see if the devices can help. We need to give it time. Priority is given to households with a track record of 4 or who has a higher risk of fall. We have engaged the Hong Kong Shu-Yan University to conduct an evaluation. The assessment covers 4 areas. The level of risks of these households. The 300 households may be from different groups. There may be PWDs or elderly family members. We want to gauge the ease of use of the equipment, the satisfactory level of the equipment, and the reliability of the system. Say, for example, any false alarm, and whether it can effectively make the detection and trigger a call for assistance. So we'll have to see which equipment is good and right for the households. That's why it's run on a pilot basis to start with. If need be, we will see if we can expand the number of quota or whether we can regularize certain items. We'll make use of this pilot scheme to make an assessment before we move forward. In terms of district care teams, we'll continue with the measure starting from the term in April. We have adjusted upward the amount available. We have drawn reference from the use of the subsidy. We have heard views from the district teams as well as done some liaison with the Home Affairs Department. We want to be as flexible as possible. There is already a high level of flexibility in place. The subsidy can be used to rent premises or engage staff members as well as procure equipment. When they build experience, the care team may have good ideas on the different uses of the subsidy. We will monitor the use of the funding support. If need be, we will see if an adjustment can be made when resources allow. Judging from the past utilization, we think that the current amount is sufficient. Next, Mr. Hong Kam In. In the past few years, the government departments have been doing better and better when it comes to assistance. We've been working in a district for 25 years. I've seen carers growing old from the age of 20s. Now they have become people who need care instead of carer themselves. There will be a greater need for financial support from the government. It's something that our society will have to shoulder. The pressure is building. Carers have different backgrounds. They face tremendous pressure and stress. We see that the coverage will be expanded to housing society, from the housing authority to private buildings. There are also trainings to property management companies, reaching out to 400 companies and training 14,000 front lines, covering about 4,000 residential complexes. That's quite a high level. So what does the training entail? Some carers think they can handle everything. They don't need help. That's what they think. In that case, how do you give intervention? Sometimes, in the face of these cases, social workers or care teams can't find a way to provide assistance. Well, what will you do in terms of referral for these cases? Mr. Chong Ho Fong talked about the care teams. I echo his views. Let me declare that, I am a member of a district care team, and there are some NGOs running the district care teams. The team members give everything they have. They do their best to make referrals, to pay visits. They run in small offices in some public housing estates. Would there be support provided so that the office can be used as a respite service unit? The carers can just drop the person they care for in the office so that they can go and run errands. I think that we lack manpower to handle administration. Care teams will have to fill in forms, which is a form of administrative pressure. Care team members are adept at taking care of people, but when it comes to filling in forms, that's difficult for them. We need administrative support. We have over 400 care teams. That's a huge support, but we need more help.
Thank you, Chairperson. So about the resources for care teams, we will talk to the Home Affairs Department to see if we can make adjustments. In terms of carer support scheme, I'll ask my colleague to add on that. But I think it may not be what our members expect, because our resources are used for early detection and intervention. Because maybe some patients have early dementia symptoms, and we will look after them when they go out. So these are what our frontline PNPs can do. These are very risky cases, and these are some basic training we provide. Assistant Director, please. So in terms of our support for carers project, our target is dementia patients, elderlies. And some of our trainings now include some carer-based knowledge. Because elderly people will maybe sometimes walk in their buildings, so it's very important for the PNPs to know how to support them. And they also need to know how to help carers and carees and how to interact with them as well, because they see them every day in their neighborhood. They need to provide some care for them and how to take care of elderly people with dementia. For example, we have a phone card for them. It's a contact list with numbers of important social service providers in their neighborhood so that they can help when someone in their neighborhood needs these services. And also we encourage them to accompany these carers. As for whether there's a referral mechanism, we do not prefer to add on their workload to fill in forms and stuff. So we would just like them to know where they can contact service providers. So in terms of the training, apart from reaching out to the service providers, we also hope that some NGOs will reach out to these caretakers, and they sometimes also reach out to the PMPs and see how they can help. So it's not about asking the cases to contact our centers. The PNPs can also provide support and help our social workers to reach out to these cases. Thank you, Chairperson. Next, Mr. Chen Wen-Kong. Thank you, Chairperson. I would like to follow up on respite services. So I see in paragraph 10 that the government will enhance respite services and also add more quota. But I would like to know the total demand for respite services, for residential services, daycare services, and also household respite services. What's the waiting time, the average waiting time, and whether the administration has set a reasonable waiting time, and also whether there are service figures. Last year, the Ombudsman published a review report and revealed that respite services had not been used a lot, and respite services are very selective as well. They are trying to stop carers from applying to their services. So I would like to ask the administration whether they had follow-up on the Ombudsman's suggestions and regulate respite service providers, and whether there are any measures stopping these respite service units to do the same thing again. And I'm very happy to see that the work for the data platform has been going well, but I would like to ask whether there is a schedule for and roadmap for the data platform, and whether the coverage for the data platform will be expanded. The data platform has already covered public housing estates and also 3 new buildings, but for private housing estates and also elderly people in other households, they need support as well. But there's no data for these populations. So I would like to know whether the administration will have data about people with caring needs in private housing, and whether there will be a more comprehensive network. Thank you for your question. I would like to ask my colleague to add more on the data platform and also respite services. Actually, in my opening speech, I mentioned that we are focusing on elderly people in 3 new buildings because they have a higher demand. Because I'm talking about those who are not covered by SWD services. We are already asking the Home Affairs Department, also the Census and Statistics Department, to look into the matter. And we also asked the care teams to help us. So we asked the care teams to reach out and see if there's a need and see if we can include them into our data platform. And also the respite services, our colleague will provide more details later on. Now, I would like to talk about the hotline. We reached out to 18,000 cases, but but only 303 needed respite service referrals. I understand that some of our citizens would like to have long-term respite services, but we don't think it's the best option because the bed will be occupied for the long term instead of being used by someone with a short-term need. So we hope that our subsidized organizations, maybe if they have a vacant bed, it can be used as respite service. We face different issues, as mentioned. For example, the eligibility criteria, etc. As mentioned by the Ombudsman, there are many issues, and we will follow up on that as well. The Assistant Director, please. So I would like to brief how we have followed up on Ombudsman's suggestions. In short, we have already asked the elderly care homes and also daycare residential centers to use some vacant quota to provide respite services. And we will also assess the distribution of respite services in different districts. We have also increased the quota for respite services. We have already reminded and will also keep an eye on service providers if they have been updating the information on their registration system. We will follow up if they don't update regularly. If they still don't update regularly, then we will enhance, we'll scale up our actions. There weren't any strict regulation on the mechanism. We have simplified the registration forms. We also asked all units to add unnecessary checkups. We have also enhanced our training. The staff must help the applicants to solve different challenges they face when applying for respite services, including transportation or body check. We keep a close eye on these respite service providers. We will randomly call them and we will follow up afterwards, no matter in terms of their attitude or how they interact with applicants or how they keep records. We will check and we will follow up. Other than that, we also encourage the hotline service to arrange for respite services so that carers can check more conveniently. Some respite services are located in the urban area, so it's more accessible. It's not in very remote areas, but it is very troublesome to ask every service provider. So the hotline can ask on behalf of the carers. If they need to pack their daily goods, the hotline will also provide some care items, basic items for the carers so that they can send the items to the elderly homes. If necessary, the hotline will also send a staff to help. So we will promote the use of hotline to arrange for respite services because we see that the pain point is a lot of things to take care of during the application process, and it's very demanding for the applicant to handle everything by themselves. So we provide support through the hotline service. So in the process of applying for respite services, if the hotline identifies any issues with the service providers, they will notify us and we will follow up. We understand that carers are very dedicated, and it's very hard for them to leave their caretaking duties. Therefore, we are going to organize respite service tours for carers without urgent needs, so that they can arrange for maybe a trial for their carees, so that they can make a more informed choice. So to let them try for 1 to 2 nights, and this scheme has received very positive feedback. We can see that some carers, when they need it later on, they will consider using respite services. And during the respite period, the centers will send the carees back home, maybe to let them tell the carers how they have been doing, and the carers can be more relieved. By doing so, the carers will be more willing to accept respite services. We will continue to promote the services we provide, and we also see that the user rate of respite service have been rising. We would like to emphasize that these respite services should be well utilized, but if the user rate is high, maybe 90 to 100%, then it is very hard for us to find vacant beds if there are urgent needs. So we will see if we will arrange more respite services in the neighborhood. For example, for the Wangford Court fire, there are over 100 elderly people and people with disabilities. They have been arranged with beds, but it's not easy for us to find over 60 beds in such a short period of time. So if we have vacant beds in hand, then we will be able to handle. That's all I have to say.
Well, this is a joint discussion. Members who have just arrived, please be aware of that. Next, Ms. Grace Chan. Let me declare first that after April, I am involved in the work of the Information Gateway. You have mobilized different parties to help. You have handled difficult cases. I would like to supplement what Mr. Cheong Pui Kong and Mr. Hong Kem In have said. Social workers and care teams have been mobilized. There are 160,000 calls and tens of thousands of visits have been paid. This means there is demand on manpower. Let's see if the administration will consider increasing social worker manpower. The other thing, care teams have paid visits, and if necessary, they would make referrals. Well, it's only 8%. But for some cases, it's not that there was no need. It's just that after discussions, they resolve the difficulties themselves. But there are high-risk households. Of the 30,000 high-risk households, is there classification of different levels of risks? How many of them are high risk? How many low risks? You can give me the information afterwards. We rely on admission information of the hospital authority to identify hospitalized carers, and that's confined to those who are living with the parties under their care. But there are also carers who live separate from the parties they care for, and they are hospitalized. Will there be an expansion so that these cases will be identified as well? Under Secretary, I will answer first. In terms of manpower, I thank Ms. Chen for forwarding the views of the sector. These cases live in the community. It's just that the parties themselves did not know where to turn to seek help. Now they are identified, and we will provide assistance as needed. We will have to keep in view the number of cases, the level of workload, to see if it exceeds our capacity. It's not the case that we'll have to increase resources because there are more referral cases. That's not the logic. In terms of risk level, I'll defer to the Assistant Director. The pilot scheme doesn't cover recipients of social services. So we're talking about people who don't know much, don't know enough about services available. But the Housing Authority has the information of the household, say for example, those elderly people living by themselves or with their partner. We want to make use of the pilot scheme to first reach out to these households to get an understanding of what they need and their household situation. That is, to gather information first. The referral rate stands at about 9%. We have the addresses of these households. We know that they are, say, elderly persons living with their elderly partner. The care teams pay visits to them and tell them about community support. Not every household can be covered in our reach. If the care teams are unable to reach them, then another visit can be paid later on. During festive days or when the weather changes, the care team can ask after these households and make use of the chance to tell them about services available. And of course, it's down to the household themselves to decide whether they need it. Even if they think they don't need services, care teams can continue to pay them visits. When need be, referrals will be made. There is a process. Care teams have been very dedicated in following up on these cases. If necessary, the cases will be referred to the relevant service unit. That's my reply. Thank you. Will we be given information about the distribution of different level of risks? Referrals have been made to service units. The risk lies in the fact that is an elderly person living with an elderly partner. The risk of these households is high, and also we'll also consider the services needed. Next, Mr. Alex Fan. The first part is in relation to the data platform. Paragraph 6 says that at the end of April, district teams have reached out to 35,000 high-risk households and made over 2,900 service referrals, less than 9%. At the end of December last year, the care teams have visited over 12,000 households and made about 2,700 referrals with a rate of about 7%. It seems that the referral rate stands at about 7 to 9%. There is no marked improvement. But we have a large amount of high-risk households. How come there is a low referral rate? Is it because that the matching criteria is too lax, so high-risk households needing referrals are not referred? There are 35,000 households being identified at high risk. Have you done any analysis to identify those who are in genuine need of service needs, but they have not been identified as such? You need to have more objective data for your assessment to expand the coverage and enhance the precision of the identification of the system. The second part is about support for carers. First, training for property management companies. I'm a member of the Property Management Authority. Training has covered 14,000 personnel, but the PMSA has not kept the data, the Property Management Services Authority. There are over 15,000 property management personnel. They have to complete a certain number of hours in training. These trainings can be organized by eligible or authorized organizations. Will you take the initiative to collaborate with the PMSA and include these courses into their CPD to enhance the recognition and coverage of these courses? There is the pilot scheme to install smart or intelligent systems. So far, you've received about you've only received 52 applications, which is rather low. What's your interpretation? Will you enhance publicity? Any preliminary results of the work done by Xiuyan University? I thank Mr. Fan for his views. The Support for Carers project is done on a voluntary basis. If they will consider incorporating this project under their CPD program, we will be very happy to do that. After the meeting, we will liaise with Mr. Fan, who is a member of the Property Management Service Authority. We'll deal with that after the meeting. In relation to the intelligent detection system pilot scheme, we've run it for about 6 months. We have received 52 applications, which is quite speedy. We're more concerned about the number of applications exceeding the quota. The referral rate under the data platform, it hovers at a certain rate. We have provided information about 54,994 households, and visits have been paid to 35,558 households. These are households not in receipt of any social services. So those with the most need have already been recipients of social services. But there are also households of elderly people living by themselves with elderly partners, or households with PWDs. People who are in their 70s, if they are not currently in receipt of social services, you will know that they are healthy elderly people living in public housing estates. Well, there are households who are from poor families and they don't know about services available. In Sham Shui Po, the referral rate is higher. We have paid visit to 1,966 households and we have made referrals for 628 households. So it's a high referral rate. There is a different distribution in different districts. We will monitor the changes and update members. I will liaise with Mr. Fan in relation to what he said about the CPD.
Wait.
So next, Ms. Jovi Chen. Thank you, Chairperson. Using technology to help the elderly people and caretakers is a trend, and this is the consensus in our committee. So I would like to follow up on carer support services. There are a lot of community support as well. Our party launched a scheme using intelligent guest readings. If we detect that the guest has not been used for 2 days consecutively, then we will contact the emergency contact of the elderly people. And I know that there are some other services, some other detection services, and supported over 1,000 households. And up until the April 2026, installing an intelligent detection system for households. There were over 550 applications. I think there's not much application compared with what we are doing in the community. Is it because there's not much promotion or publicity? And I would also like to know that the pilot scheme lasts for 2 years, and what will there be after the pilot scheme? What's the roadmap? So there are detection systems in elderly household. Is there an exit plan? What will we do afterwards? And whether the relevant data will be uploaded to the data sharing platform. Thank you, Chairperson. Undersecretary, please. I would ask the Commissioner to provide more details later on. We are not worried that we are not promoting enough because it has only been run for a month. We are trying to go ahead of tragedies. And the system is about alerting us before accidents happen. Because you can imagine if an elderly person, they're not feeling well at home, so they don't cook for 2 days. There will be a notification, but it may be too late for us to reach out after 2 days. So what we do now is to have a detection system for falling, and will help us report to the police. This is earlier. We are not saying that guest reading is not important, but if you report those who don't cook for 2 days and there's an alert, there will be false alarm. That's why we need a pilot scheme. We need to know how to make a reasonable plan that won't generate too many false alarms in 18 districts. So, Commissioner, please. Thank you for your opinion, Ms. Chen. We actually have 2 schemes. The first one is about falling detection. The other one, it is a smart device scheme. Apart from falling detection, it's smoke and also some motion detection devices. Our current scheme runs hand in hand with the emergency alarm system. So when you say if the family members will be alerted if the guest reading has not changed for 2 days, our current system will activate the safety bell if they detect fall. Our current scheme has 300 quotas. So we need to see what is needed by our service users and what are the devices needed. We need to assess what suits our service users' needs the best. We asked the Xuan University to conduct a research for us, and we will kick off the research after recruiting 300 applicants. We will assess the user-friendliness and also the usefulness of our scheme. And this is how we are going to roll out our plan. Next, Mr. Stanley Ng. Chairperson, I have 2 concerns. Of course, we have always wanted to enhance the usefulness of our data sharing platform. The care teams have been reaching out to a lot of elderly people, especially those who are living by themselves. Is our data platform able to cover these singleton elderly people and to suit carers' needs better? Secondly, for the areas with older buildings or older private buildings, some of them are housed by singleton elderly people. Some of them live with domestic helpers. It's not a very good scenario. We don't have much support, and we don't really reach out to these domestic helpers. There may be many issues arising from these situations. Undersecretary, please. Thank you for your opinion, Mr. Ng. Our carer data support platform target at the elderly people, and those, especially those who are hidden. That means those who don't use our social services often. In terms of data, according to statistics given by the Housing Authority, they are elderly. They belong to the elderly people population. There are around maybe 50,000 of them. We have identified 30,000 of them, but the rest of them we have not been able to get in touch with them. We will keep trying, and we will see if they have other demands and needs. And as for domestic helpers, I will ask my colleague to provide more details. There are 215 subsidized elder district centers, and 41 of them are elderly centers, and there is a elderly support team under these centers. They target at singleton or doubleton elderly households and take care of elderly people in need. They try to reach out to those in need and also social organizations and also property management companies to help hidden elderly people and carers. We have such network, and we will find ways to identify these cases. We will identify them using different means. Thank you, Chairperson. Next, Mr. Chong Ho Fong. Undersecretary, I would like to ask more about respite services. In my understanding, the SWD provides a web page for carers to check vacancies. But if you would like to apply for these services, then you will need social worker referral. Will it be possible for you to provide a comprehensive service for carers to apply and check at the same time, so that when organizations or social workers see these applications, they can call them and select, instead of asking the carers to call and reach out to service units, and so that they don't have to travel and fail at the end. Our hotline has already provided comprehensive support. Social workers will help carers find beds. Therefore, we see more cases referred by hotline. And the Assistant Director, please. We have a web page for respite services, and we have also provided services through the hotline. Applicants don't need to fill in forms. They can call social workers through the hotline, and the social workers will offer pickup service or handle administrative procedures for them. And we will also offer daily goods as well. We hope that we can simplify the application process and also lower the threshold so that our services become more easily accessible. And we have also simplified the body check procedure, because they need to live in groups, so we need to ensure that they don't have infectious diseases. And if they just have a common cold, then they can handle it in the respite services. We have lowered the bar and make our services more accessible. The hotline is handled by a social worker. If there's a one-stop web page, maybe you can arrange services through emails. There may not be enough lines, and the elderly people may give up if they can't call or can't reach social workers. Our hotline is sufficiently staffed, and we have enough social workers to take calls. Applicants don't have to wait, and their calls will be taken by social workers. They don't have to wait too long. Social workers may need to ask around to get more details before picking up again. But for carers, it's very user-friendly. We have conducted reviews. I believe that we have already made it very user-friendly.
Ms. Elaine Chick. Well, the data platform gathers data from the Home Affairs Department, Hospital Authority, Housing Department. It seems that it's quite comprehensive. But high-risk households are those that are hidden. From our experience, there are cases that are reluctant to receive any kind of support. The household members themselves are quite headstrong. They will not seek assistance or make report. They may be living in subdivided units. They are not receiving any benefits or subsidies. There is no record in the SWD. They don't have to go to public hospitals, so there is no record in the hospital authority. Well, out of 10 tragedies, 7 of them have never been covered by social welfare workers. Has the government conducted any assessments on the data in the platform to see if that includes cases that are not there? And are there any ways to identify the households who are reluctant to reach out? And well, because of this reason, they are not in the database. We want to target those cases in our platform. It's not that they have not received any kind of services. We're about 54,994 households are living in public housing estates. The next stage, we will cover housing society projects. Then we will collaborate with the HAD to identify households living in 3 new buildings. Yes, there are some carers living in luxurious flats, say for example, San Kwong Road, or living in North Point in middle-class housing estates. At this moment in time, these people are quite healthy. That's why they are not in the hospital authority database, and they don't use any kind of social services. So we will first work on housing society households and 3 new building households before we map the way forward. Assistant Director, we realize that there is a large amount of hidden carers. We'll first enhance our publicity effort, covering not just carers. We also encourage neighbors to show more care. Our coverage includes property management personnel. Enhancing their sensitivity will help matters. There are different groups with different needs. Professionals such as social welfare workers are not the parties some households would like to reach out to. In addition to social workers, we also have peer support. They have experience in being a carer. They have experience and they understand what carers have gone through. In addition, we have the district care teams. They are people living in the same district. We ask all these different parties to step up their efforts. We try to exhaust different avenues, and if members have any ideas, please let us know. We'll keep an open mind. I have some questions to ask. There was an occasion when we talked about asking neighbors to help discover these cases in addition to care teams. Say, for example, neighbor is aware of someone else living next door who are in need of services, then they can make referral or reach out to help them. Will you try to explore this way? Or are you doing it? If so, can you give us information? Will you do it on a pilot basis? If you rely solely on district care teams, well, there is pressure because the workload will increase. So will you consider other pilot schemes? Some members asked about the hotline 182 183. When something major happens, the lines will be fully occupied. Have you done any assessments? So far, I have not heard about any problems with this designated hotline, but will you expand its capacity? Another matter is the respite services. I've heard about complaints about assessments covering too many matters, taking too much time in order to give you respite services. So the applicants don't end up not having the time to go through it. I understand that the assessment themselves are important, but have you done any reviews on the assessment? Any progress? Who is to take my questions? Undersecretary, neighbors is a good contact point. We will look into it and give you information afterwards. For the other matters, I'll defer to the Assistant Director. Health check before respite services are given. Of course, for applicants, they would like to get the service as soon as possible. But from the perspective of the homes or the service units, well, we're talking about someone living in a group. We need to identify cases such as difficulties in swallowing, because we want to identify special needs. A balance needs to be struck. The health check can be done in advance. That's an expedient measure. Even for the experience service, the applicants will have to go through the health check. A call can be made to 182 183 for support and subsidies. For the health check, there is a validity period, which is, at the moment, 6 months. So if there is another occasion when respite services are needed, there is no need to do another body check. There are also emergency arrangements. The service can be provided without going through the health check first. There are resident doctors at these respite service units, so when the applicant is admitted, there will be a quick health check done. We're talking about basic necessary items covered by the health check. That's my answer. You talk about admission first and assessment later. Are there concerns from the service providers? We've talked to them. They are happy with the arrangement. They'll make the arrangement as soon as possible. An assessment will be done within 3 days. Another question. Carers may be reluctant to go to a center. What about at-home respite services? We do have this service. It's provided by some service organizations. It's rather manpower intensive, this kind of service. in advance, the service provider will need to conduct an assessment to make sure that the home condition is suitable for providing the service. It's difficult for us to expand the scope of service, but we see that different service providers are considering how to provide this home-based respite services. If the service providers know about these cases, or if there are special circumstances, the service providers are happy to provide the service needed. I think it depends on the actual situation before we can consider expanding the scope. Daycare centers and residential centers can provide respite services. From what I heard, there is an acute demand for home-based respite service. Is that right? It depends on the actual situation. Say, for someone who is physically disabled, if there is a low level of mobility impairment, then usually they don't mind whether the service is given in a center or at home. However, for those suffering from a higher level of disability, it might be difficult for them to leave home. We have in place an ICRC, an Integrated Community Rehabilitation Center, to be launched at the beginning of 2027. That center includes home-based respite services, but it is a hybrid of a center-based respite services. Those with difficulty leaving home, and when the carers have to go somewhere else, yes, the service can be provided. Service providers have expressed concern about manpower demand, because in these cases they may need to send 2 people instead of 1, so that will put a strain on resources. Well, the service is provided depending on the situation. Next round, Mr. Alex Fan, 4 minutes, question and answers included. The second item in the agenda, Paragraph 10, respite services, under services supporting the carers. Respite services can provide respite for carers. Are there any medium to long-term planning by the government for continuous provision of service timetable? Well, is there a timetable setting out the number of places that will be added? Does it align with your budget, or is it the case that you don't have the resources to provide what you have in mind? And it also says in the paper about making good use of vocational vacancies to provide respite services. I think it needs long-term planning. I do appreciate that resources are limited, and this will be a transitional arrangement. Whenever there are occasional vacancies, the places can be used to provide respite services. So, medium to long-term planning. I will take the question first. I understand that members don't want to see vacancies not used, and it can be mobilized and turned into respite services, but it's a tricky issue. because, well, if there are too many occasional vacancies, then the usage may be low, because when it comes to occasional demand, as the name suggests, you don't know when the need arises. We want to make good use of occasional vacancies. By that I mean when the bed is vacated and there is no plan for the time being about the next admission.
We have different care homes, but we are in a very difficult situation. We need to save beds, but we also want to match resources better. So some may concern that we are not using our resources well. So our strategy now is to make good use of existing networks so that no matter elderly people or people with disabilities, we can match them with our existing network. The respite services may not be 100% occupied because sometimes the occupants are sick and sometimes they are unavailable. The spaces can therefore be vacant and to be used by those who don't use these services frequently. By doing so, we can ensure that the respite services can be provided whenever they are needed, and they can be better used. Resources can be better allocated. Even for long-term respite services, they are in dire needs. So do we wait or do we actively match service needs? I think we still need to make good use of different vacancies. And we encourage respite services to accept occasionally needed cases, because for private care homes, if they take in these cases, maybe they will become long-term customers. So there is an incentive for them. Thank you, Chairperson. Next, Ms. Grace Chen. Thank you, Chairperson. So about respite services, again, I think there's a huge demand for respite services. And there are things unclear about the process, the application process. So I would like to know if the administration has a roadmap for review. Because in terms of allocation of resources or consolidation of resources, maybe the Bureau doesn't have to pay, or there will be other stakeholders, but we need a review. Undersecretary, please. So, Assistant Director, please. We have done a full-scale review on the procedure and all the other steps involved in the respite application process. We have the hotline, and there are throughout the whole process, there are many stakeholders. There is the body check, and also transportation is needed. And we have been tackling issues in all these areas. We are happy to listen to other opinions as well. Thank you. If there are no other questions, we will move on to the next agenda item, the other affairs, and we don't have any of them, so we will end here.